This is Mike Lewis, and I'd like to welcome everybody to The Buzz. This month, we are talking a lot about Breast Cancer Awareness Month, since it is Breast Cancer Awareness Month. That seems to flow very well, doesn't it?
Yeah,
So we have that, and I've invited, as part of our conversation today, Ms. TINA TIBERIO, who is our nurse practitioner for us here at Change Inc. And we're very fortunate to have Change Inc. with us here in our building as our school-based health. So we rely on them for a lot of medical care for our kids and our community members. So we're very fortunate to have Ms. TINA here with us today, and to talk a little bit about and a little more information about early detection, breast cancer awareness, because I would imagine most families are touched by cancer in general, but by breast cancer particularly. I know we have two women in our own family tree that have experienced breast cancer, and the strength that I've seen in them move through the process. So I'm very happy that you're here today and to be able to share your experience, strength, and hope with us as we talk about breast cancer awareness.
Okay, thanks for having me.
Sure.
So we all know October is Breast Cancer Awareness Month. This is an annual health campaign to increase awareness for the disease. The goal of this campaign is to get as many people as possible involved in raising awareness and funds to help support research and support services. The campaign started in 1985 with the help of the former First Lady Betty Ford, who herself was a survivor of breast cancer. It was started to promote mammograms, because mammograms is the most effective tool to fight this disease. So according to the Susan G. Komen organization, which is like a big organization, one of the ones that everybody knows, 1 in 8 women will be diagnosed with breast cancer. And a growing number of men will also be impacted. So it's just not a disease for women. It can affect men. Death rates from breast cancer have been declining since 1990, in part due to better screenings, early detection, and improved treatments, and increased awareness, which is what this month does. There are over 3.8 million breast cancer survivors in the United States today. So, so some things for you young kids to help promote breast cancer awareness. Spread the word. Mammograms save lives. So if you have, your parents, anybody 35 to 40 years old, your moms, your grandparents, your aunts, ask them, tell them, get your mammogram, make sure you get your mammogram. Be aware of risk factors that increase your chances of breast cancer, as obesity, lack of physical exercise, drinking alcohol. Know your family history. It's really important to know that. And smoking is a risk factor. So the other thing kids could do is start taking, getting involved in local fundraisers, or even start a local fundraiser. The fundraisers are important because they provide needed education. They are free resources and free screening. So there are there's a program with Change Incorporated Family Medical Care that people who don't have insurance, we can get them free mammograms. It's a program they have, but these fundraisers help support that, and they also help support support systems, because it's very important when somebody's diagnosed with cancer, and that there's support groups. So these fundraisers provide money for that. So, yeah.
No, very good. And I think just from our own family story, that self-detection was key, instrumental in the first raising the red flag.
Absolutely. So I would just advise all females, and even males, when you talk to your primary care, there is a a screening that you do monthly on yourself, and you could be taught at one of those appointments. Yes, absolutely.
Very good, very good. And I know that was the first red flag that brought it to their attention.
Yes, absolutely.
So very good.
Yep.
I didn't know that there were so many resources available too, and it's great to hear that the death rates have been decreasing over time, and I think that's because of all the new education and that we've been doing. I mean, our kids grew up with pink. October is pink.
Absolutely.
So it's been here for a while, and it's only, I think, through education and that awareness that we can save
Sure,
lives.
absolutely, absolutely. I agree. Yep.
But I really appreciate you being here and
Thank
taking
you.
your time to be with us.
All right, thank
and
you.
sharing your experience, strength, and hope with us.
Yeah.
Because what we want to do with our show is that we want to contribute to the quality of life of people. And I think if we approach it with some of these little things that might not get talked about much around the table,
Sure.
but if our students and can take it home and talk to their parents
Sure.
and their family members, maybe we not only will improve the quality of life over the course of this year with the various topics we talk about, but with breast cancer awareness specifically, maybe we even save some lives.
Sure,
And
absolutely.
I think that people need to understand that they do have that part to play.
Yes, I agree.
So,
Yep.
all right.
Well, thank you for having me.
You're welcome. Thank you very much, and thank Change for you to always be here for us and taking care of. I know you take care of a lot of our kids.
Yeah, we do. We love it.
And I love that you're here.
Great.
Thank you very much,
All right,
Ms.
thank
Tina.
you. Thank
You're
you.
welcome. And that'll be for the buzz today. And we will have a second show on breast cancer awareness just to follow up. But that will be forthcoming. So we're looking forward to going more in depth about Breast Cancer Awareness Month before it closes here on the 31st. But thank you very much for your time. Thank you very much.
Thank you.
It's been a pleasure.
Thank you.
And I look forward to seeing you here in the building.
All right, thanks.
All right. Thank you very much, Miss Tina. All right. Bye. Take care.